really gives an example of how do we harvest what we already have, what we already know. And while he talked about mental health services, come on up, Hendricks, Niwa, and I'm sure that David will be back in 1 second. How do we harvest what we know for the same agenda in prevention? And we have some models now at a system level and with mental health. Could we do, what would it look like in the field of prevention with evidence-based interventions? We're on to our last panel for today, and Hendricks is the chair.
Thank you, Mary Jane. Just a brief comment about this one. I think we're at a change in the basic models that we have for delivering of programs, practices, policies, particularly for youth who, if you haven't recognized, are living a different environment in the digital age than what we grew up with. So the people in this room are in fundamentally a perplexing opportunity in here for looking at how do you reach kids in here. In environments that we've developed for delivering of interventions in the last over the last 3 decades or so, most of those have been, parent programs, face-to-face kinds of programs in here, and people do not live their lives as much that way anymore. The kinds of technologies that our 2 speakers are going to be talking about today is the wave of the future. We don't know exactly which of these kinds of methods for looking at the use of technology, e-health and m-health, for example, are going to be successful, but we have some great ideas around here and inspiration. So the first presenter is going to be David Moore, my colleague from Northwestern. David is the professor at Northwestern in multiple departments, preventive medicine in the first one, with also in psychiatry and medical social sciences. He is the director of an NIMH-funded Center for Behavioral Intervention Technologies. It looks like e-health and m-health interventions are the part of it. What's really useful in here is his integration of not only the technology around here, but his really deep understanding of psychological and behavioral interventions that address the unique needs in rapidly changing technology environments for our interventions.